Black girl has something to say. Let's get into it. So, I wanted to take this time I want to use this time to chat about some health and wellness and really just talk about the professional development program that I have created that will include a variety of healthcare courses. One being racial disparities in healthcare, and two being healthcare is politics. Now, if you've been following me on this journey or you've migrated over here from TikTok, you'll know that I just wrapped up the last 12 weeks of teaching racial disparities in healthcare. Racial disparities in healthcare is a combination of some courses that I taught as my tenure as a professor, which was healthcare ethics, minority health, and introduction to healthcare. The combination of those three courses I put together to create racial disparities in healthcare. Now, when we consider what is going on currently in the U.S. healthcare system as it relates to politics, that also allowed me to pivot into healthcare is politics. So the links for for you to register will be in the description. Also, I find it so, nostalgic that I'm seeing all of my work come together full circle. And what do I mean by that? All of the doctoral work, like going back to the fact that I graduated high school in 2006, the summer of 2006, I graduated May 2006, May 25th, 2006. There's just some dates you don't forget. May 25th, 2006. And I started college, my undergrad at community college, uh June, end of June 2006. I did like a summer B course just to get my feet wet with college, to kind of see like what that's going to look like. And mind you, this is the early 2000s, mid 2000s, whatever you want to call it, where at the time college um was seen as expensive. It's always been seen as expensive, but community college for a first gen um eldest daughter was seen as a distant dream. And so to go to community college allowed me the opportunity to really work hard and go to night school and work in the day. And I was taking one class at a time, paying for my own education. And so the purpose of me creating this space is to make it accessible, and really it's professional development, right? It's not a college, but it's me utilizing all of my college education put together to create this platform. So I also published this book in 2020 during my doctoral education, my doctoral educational career. I published this book in 2020 called Nevertheless She Breastfed Despite Racial and Cultural Disparities. And it was funny because it was in my doctorate where I started to learn more about racial disparities. And I was like, oh, I experienced that. Let me put it into a book. Prior to publishing this book, I had published another book at the recommendation of my professor. And she recommended that I publish this book called, it was a meal plan guide that I published, that I created for one of my courses. It was community health promotion and disease prevention. And when I did community health promotion and disease prevention, I was talking about diabetes and how it affects the Black community. Because the more that I recognized through my doctoral studies, oh my gosh, Black people are predisposed to a lot of diseases, right? We're already predisposed to a lot of diseases. But also once we've identified what the disease is, we still face things that cause disparities like our race, lack of access to care, and then our social determinants of health. And because of our social determinants of health here in the United States, the social determinants of health is, could be where you're born, where you live, your genetic makeup. Like there's so much that comes into the social determinants of health. And I got some notes here because I always like to make sure that I'm giving you the latest and the greatest when it comes down to the information that I've come to learn and that I want to share with you all. Right? So some key factors about social determinants of health. Some major social determinants of health is your economic stability, your education, your social community, to give you some context, your health and healthcare. And so having lack of access to healthcare does create a space where we don't see people being well. We don't see people taken care of. We don't see that, things are being addressed like cultural competency and implicit bias, right? So because of all of that, I created a course called Racial Disparities in Healthcare. I started teaching it on TikTok. There is a playlist here on YouTube, but that playlist just has YouTube shorts in it with discussions. And those discussions were things that we discussed throughout the course, where people could leave their contributions and really cultivate this space where we're learning, where we're engaging through learning. Right. And so I took down all of the videos and put them into a learning management platform, and people are able to register for the course and take the course at their own pace. It is 12 modules, but you don't have to take 12 weeks to do it. I think if you sat down and did it and listened to the videos like a podcast, essentially you probably could finish it in a day or two, and then a professional development certificate will be emailed to you. We had over 40 people register for the course, and about 15% of people purchase their professional development certificate to enhance their resume and to show proof that they went through this course and that they learned something. So they got a certificate and a letter of completion. So you will have access to that as well. Because of the success of that course, it allowed me the opportunity to start teaching Healthcare is Politics. Now, Healthcare is Politics is a combination of some courses that I taught as a professor, which is legal aspects of healthcare, ethics in healthcare, and healthcare ethics. Because those three courses, we find that when we talk about healthcare being politics, what I always would tell my students in the healthcare ethics class is that just because it's legal does not mean it's ethical. And just because it's ethical doesn't mean they're going to make it a law. And so your moral compass determines what you deem to be right, what you deem to be ethical. And when we're talking about doing things for the greater good, when we're talking about holding space for people of all races, people to have, access to affordable health care, because here in the United States, that's not our case. Our portion is not affordable health care. Our portion, because I remember in my master's degree, and my master's degree is in health science, where I concentrated in higher education. And I'll get back to that. But our case here is that healthcare is seen as a luxury. Either you can afford it or you can't. And that's unfortunate when you have when you have organizations like the World Health Organization or the United Nations wanting to say, hey, healthcare for all. They have these development goals, the SDGs, the social development goals that they created. There's like maybe 13 or 16 social development goals that they have created, that they want to see the world come together for the betterment of health. And so I made a video on TikTok where I was talking about the perception that we have of healthcare here in the United States is one that we look at from not the best point of view, when the United States is just a small portion on a global scale, right? Globally, everywhere looks at peace. They look at harmony. They look at the whole person when they are assessing a health need. Whereas here, we just look at the symptom and we're going to just fix the symptom. I had a call with a mutual the other day. They reached out to me and they wanted my advice on something. And I'm not one to typically necessarily give advice when it comes to health things, because I'm not a medical doctor. But with this, I was able to lean into the research that I know. And the research that I know says, if you go see your doctor, right? If you go see your doctor and they aren't able to give you a solution or give you an action plan that might lead to a solution, continue to ask them for more, right? So this was an incident where she's having some numbness in her hands. They did, I think she said an x-ray, and they found nothing. I said, but do you still have the numbness? She said, yes. So I said, what you need to let them know is that you are still presenting these symptoms, and what would be the next steps. And so that's literally the whole purpose of everything that I've come together to learn when it leads into healthcare, health science, and learning about global health. Having a doctorate in health science that concentrates in global health. Going back to me having a master's in health science that concentrates in higher education meant that I learned syllabus creation, curriculum creation, how to deliver said curriculum, how to deliver, put these topics and organize them thoughtfully, week by week, level by level, as it relates to health science. And health science is can be seen in some cases like a social science, because it looks at ethics, it looks at sociology, it looks at some STEM, some a lot of things in STEM. And being able to put that together and look at the community and look at the world and see where people are and meet them at that need. So if you are interested in racial disparities in healthcare, healthcare ethics, getting that professional development certificate, the link is in the description of this episode. And so I encourage you, because I look forward to your contribution. There's discussions, there's videos, there's a whole catalog that I have put together into a learning management platform, so that when you click to register, you'll pay for the course. You could also pay in full, so that's making it affordable and accessible. You could also pay in full, but you have the opportunity. You will get a link to the classroom where you can go into the classroom and do it at your own pace. Once it is complete, it pings to me and your certificate will be sent out to you. So I look forward to you joining me on this journey to professional development as it relates to learning more about racial disparities in healthcare. And healthcare is politics. And keynote, we won't just be learning about U.S. health politics, right? We will, U.S. health policies. I can also implement some global health policies so that you can see why there is a disparity. Because if we don't understand the why, then we can't come up with a solution. So I look forward to your contribution. And don't forget, Black Girl Say Something airs an episode every Friday at 1 p.m. Eastern Standard Time. And don't forget, we have a array of episodes that you can listen to. So in the meantime and in between time, tune in. And don't forget, you can also subscribe to our Patreon, follow us on TikTok, like, share, and subscribe right here on YouTube, because you're seeing this right here anyways. So tap in and tune in. And I look forward to teaching you. Until next time, take care.